So
Yes, good
while he's
morning.
doing that, let me introduce him. He is the Assistant Professor of Radiology and Interventional Radiology at Cairo University, Egypt. Vice President of Interventional Oncology in ISMIVS, founder of the first Center of Focused Ultrasound Tumor Ablation for treatment of tumors in the Middle East and Africa. He is elected Fellow of the Arab Society of Interventional Radiology and the board member and treasurer of the Egyptian Society of Interventional Radiology. Do we have him online? Professor Ahmed?
Yes,
Oh, yes.
yes, good
We'll have
morning.
your slides shown. Yes, we can see you now. Let's welcome Professor Ahmed.
Good morning. Good morning, everyone. It's a pleasure to be with you. I am actually missed to be with you on site, but unfortunately, due to my work situation, today I want to share you uh, a brief about our experience in HIFU related to liver and other cancer application. Of course, we have an intervention oncology grow very fastly in the last few years. It's composed of ablation, embolization, and both of them considered as an invasive procedure. The HIFU is another era of interventional radiology, not adding a lot for the practice, because now we can use an interventional radiology without using a puncture. This is the timeline of different type of interventional radiology. You can see we have the interventional radiology starting since 60s. It's the era of percutaneous treatment, 70s, about balloon dilatation and angioplasty, 80s, and of course 70s also the transhepatic embolization. At 80s, we talking about the different stenting and other application. Since 19s and last 20 years, we introduce the HIFU as another method of intervention radiology, which will be a very great method of treatment. Of course, in Egypt, we can do since few centuries, we can do an endoscopic surgery without anesthesia, and we can do a circumcision with a local anesthesia. So the minimally invasive procedure is an very old procedures. Of course, the HIFU is growing in everywhere. We are honored to be the first one in Middle East, and we starting work with dear Professor Zhang and Professor Wang and dear Ruzi and everyone, Dr. Shen and everyone in the society since 2012. We have the GC machine, and we can see there is a very large application of treatment for HIFU all over the world. We have the different application of HIFU in everywhere in North America, Europe, and in Asia, South America. Of course, the ultrasound guided HIFU is the most applicable machine, especially in the gynecology and oncological method, except the spinal metastatic lesion. Outside USA, the HIFU on oncological application is very famous in Europe and Asia. And in our center, we apply for different application like breast lesions, kidney, liver, pancreatic, soft tissue tumors, bone metastasis. We apply it also for pediatric different cases, chest wall tumor, abdominal wall tumors. Most of our cases are fibroid and endometriosis, and we widened the application. Of course, we have now 9 applications approved by FDA. The last one is histotripsy for liver tumor at last November, and this is very good step in the HIFU application for liver cancer. Of course, the HIFU is very easy. We can repeat it, no iodizing radiation, no hospitalization, but we must be acquainted very well by the anatomy, proper positioning of the patient, the different surgical approaches, and the direction and the effect of the power. This is very important golden rule. If we want to get better effect and less time, we must have an optimum distance, proper size of the tumor, and less vascularity. If we can justify this by put the patient in proper positioning, we will go through the least distance. If we have a very large tumor, we must reduce the size, maybe by augmenting other methods of treatment. We should reduce the vascularity, especially in large malignant tumor, or even now we can combine this in very large fibroid tumor. Unfortunately, the pancreatic and liver cancer growing and increasing, and we will face a larger number of pancreatic and hepatobiliary cancers. Also, the COVID-19 impact on the public health reduce the number of screening patients and early treatment and proper diagnosis and gradual treatment. So we will face the large increased number in the patient mortality related to the cancer. Also, the hepatobiliary cancer, especially the liver and pancreas, considered as the fourth and fifth cause of death in male, and maybe also the fourth and sixth in female. The HIFU is not an emerging treatment. Now is well established. We have a lot of patients, maybe thousands of patients treated for liver, pancreatic, prostatic, soft tissue cancer, maybe exceeding around 300,000 patients now. According to these statistics, we reach up to 250,000 patients. Most of these patients are liver and pancreatic patients. Of course, I consider the HIFU is a very important arm of oncology intervention procedure, and the oncology intervention now considered as the fourth arm of cancer therapy besides the surgery, radiotherapy, and the chemotherapy. The aim of the most ablative therapy is to selective destruction of the target tissue. As the HIFU considered as the most precise methods of destruction. There is different combination of mode of action of the HIFU, and this is very unique for HIFU. Not only thermally ablated the tumor, it's also making a cavitation, histotripsy, lysotripsy, and according to the different power, we can combine most of these treatment types. The mode of action is different modes. We have a tissue destruction, either mechanical by histotripsy or thermal, or even secondary due to microvascular disruption. Also, we have a very important role by immunomodulation. This is a new era of the treatment of different type of the cancer, and also the HIFU can improve the drug delivery for chemotherapeutic and immunotherapeutic agents. This is a very important question. We facing this since 2001 or 2002. Is the radio frequency is stable? We can kill the tumors. Now, everyone asking, is the HIFU is stable? We can destroy the tumor. I think it's the HIFU will take over this era, as the radio frequency and the microwave now is very established. Of course, this is a very important paper talking about the HIFU in application of HCC, and they found the same effect of radio frequency similar to HIFU in the small tumor by my eminent colleague, Dr. Tanto. It's the previous talker. I'll show you some of our cases. This case similar to the case he present. This is a patient amenable for liver transplantation. We have a large tumor. We did downstaging and ablate almost 95% of the tumor, and the patient go for transplantation. And this is patient nearby the hepatic veins, very dangerous to do radiofrequency or microwave, and this is after HIFU. Another case of colorectal metastatic lesion centered on the right portal branch, and of course the metastatic lesions are very sensitive to the HIFU treatment, especially if hypovascular like colorectal metastasis or pancreatic. They giving a very good result, and you can see the treatment plan, and this is immediately after the HIFU, and this is giving the same effect by routine ultrasound like radiofrequency or microwave. This is a follow-up showing a very safe procedure. The portal vein and biliary tree is intact, and the lesion is ablated. Another lesion in segment 4, it's a very easy one, small one, can done by any method of treatment, radiofrequency, microwave, HIFU, and the patient asking for HIFU. This is the treatment plan, and this is after treatment. We can see we can ablate a very good zone with a safety margin. Even we have a hemorrhagic coagulopathy. This is a very good sign of very good ablation. Another lesion in very sensitive area nearby the colon and duodenum and gallbladder and adjacent to the kidney. We can see we make a very efficient ablative zone, and this is demarcating that the HIFU is very powerful. We should be careful when using the HIFU. Another case with hepatic metastasis, we can see we have a partial response, and we add a new chemotherapy, new adjuvant. This is a very important rule for HIFU for a metastatic lesion. Not all the lesion aimed to be completely ablated. Sometimes we make it as an adjuvant for chemotherapy. After the new adjuvant chemotherapy, you can see it's almost completely ablated and disappeared after one session of HIFU and the new adjuvant of the treatment. Another case with ill-defined margin, HIFU, you can see very good results, and we accompanied by radiofrequency because we can't kill all the tumor. This is after radiofrequency. This is before HIFU and radiofrequency. This is after HIFU and radiofrequency. So we can make it with another method of ablation or embolization to get a very good results. We can see this is different types of cancers, colon and pancreatic cancer. Sometimes we have a very intense activity in PET scan. We have also a hilar lymph node. We did HIFU for both, and after this, we can see after the effect of the chemotherapy, there is a significant reduction and the significant reduction in the uptake of the lymph node and in the tumor metastatic lesion. We can use the HIFU in another concept as one of the arm of the treatment of the metastatic lesion. And this is what we wanted to introduce for the community of the surgeons and oncologists. We are not alternative for the radiofrequency, not alternative for the chemotherapy, but we can use the HIFU in very specific patient. Don't put the patient in the same shoes. This is a very difficult case for the ablation by needle because it's a surface invading even the liver capsule. We can use it, the HIFU, very safely. We have a heterogeneous ablative zone. We have a subcutaneous edema, and this is acceptable. This is not an injury for the skin. This is just a subcutaneous edema. Also, we can use the HIFU in very difficult, like this case, it's central cholangiocarcinoma in very young boy from Yemen. We have this case, we wanted to protect the biliary tree. We put a stent and making the HIFU. You can see because cholangiocarcinoma is mostly hypovascular, the efficacy of HIFU is very, very nice. We can ablate a very large zone. Another case in difficult location, capsular, ill-defined, metastatic lesion, it's a cholangiocarcinoma lesion, peripheral type of cholangiocarcinoma lesion. You can see the efficacy of the HIFU after single session. You can get a very good result. We have also an important issue regarding the synergetic thermal effect with chemotherapy and immunotherapy, and this is the new era of the treatment. And we must consider the HIFU or any thermal ablative procedures. It's not working only locally. No, we have what we call abscopal effect, that the HIFU or radiofrequency or the microwave, but now proved for HIFU and nanoknife only, they will change the abscopal, the distant metastasis affected after treating by the HIFU and the nanoknife. We must also consider the combination of different methods of chemotherapy with the HIFU treatment in metastatic liver and in pancreatic tumor. We want to push the boundaries. We can do the HIFU in unusual application, like this very large iliac bone destructive lesion in metastatic cancer patient. It's very large, so I decided to make a combination between the radiofrequency, which is cheaper and faster, and destroying the large size of the tumor. And after this, you can see the destroyed tissue. We make a bed. There is still have a marginal active lesion. We decide to make a HIFU for the margin, and the pain and stability of the patient improved very well. Another application is the desmoid tumor and the low vascular benign lesions and pediatric age group tumors. I think this is a very, very, very wide application for HIFU, and we should push in this hypovascular soft tissue tumors, desmoid tumor, and the pediatric application. You can see this is one of the patient even having a lymphovascular lesion in the neck. We used a very low power for a very few time of the HIFU. This is the picture before and after. There is a significant difference, significant improvement of the quality of the life of this young girl. There's another guy with aggressive fibromatosis. We make a combination between an endovascular embolization, then one session of HIFU. We got about 70% of the ablation of the soft tissue in the gluteal region, and there is a significant improvement in size of the tumor. I think HIFU will be the future in treatment of different malignant tumor. We should push the boundaries. We can accompany the HIFU with different methods like ablation, nano-knife, bone metastatic lesion. We can do this, all of us, to improve the quality of life of many cancer patients. Thank you very much.